30 seconds and then make sure it's dry. Using the OK method, pulling that off, putting it in the trash, and drawing up my 1 milliliter of air and inserting my air, and then pulling 1 milliliter here. Alright, I'm putting a little bit more in there because I can't get these air bubbles out, so alright, there we go. Alright, 1 milliliter here. And I'm going to do my safety and discard of this. And I'm uncapping, actually, I'm pulling up more air so that I can put my lorazepam, 1 milliliter here, in here. Okay, trash, and okay, and I left a little bit of space there so I'd have room for any air bubbles or anything. Safety, trash. There we go. And I'm putting a sterile red cap on it. And I'm going to label this. I'm going to label it, or I can still see the numbers with the patient name and the dose and the time, the name of the medication, and the date. Save that right there. If it's in my site, I can lay it down. Alright, so I'm doing my last check. I saved my vial, so I've got the lorazepam 2 milligrams, 1 milliliter, mixed with the diluent here, and it matches my label on the syringe and the MAR. Mr. Brown, could you please state your name and date of birth for me? Tommy Brown, 1214. I'm scanning his armband, and it's the same here. And now I'm going to scan my medication, and that matches. So we are good to go. I have completed my 3 checks. Mr. Brown, do you have any questions about this medication? It is the lorazepam I was telling you about for your anxiety. And now, if you need to get up, please use your call bell. It can make you dizzy and drowsy, a little lightheaded. It could affect your blood pressure and your heart rate. So if you get up, we don't want you to fall. We would like to be in the room with you, so please give us a call. Okay? All right. I'm going to wash my hands, and we'll get started, or we'll get this medication to you, okay? Flushes. Alright. So before we get started, I'm going to do my IV assessment again. There is no redness, swelling, signs and symptoms of infiltration, phlebitis. He's not having any pain. The dressing is clean, dry, and intact. And the flow rate for the, or not flow rate, but the IV does have fluids running through it, and there's no leakage or anything like that. So, alcohol swabs here. I've got my Y port that's closest to the patient here. I will keep this off and pause my pump. I'm going to wipe with my swab here for 30 seconds. And I've already crimped my port here. So I'm gonna pull this red cap off. No. I'm gonna get a new red cap, put the red cap back on. And I'm going to do my flush first. I'm going to flush this with normal saline here at a rate of 1 milliliter every 10 seconds for 5 milliliters. Okay. And I'm going to get another swab. And swab for 30 seconds. 30 seconds. Trash. Let that dry. Now I'm going to do the medication. Trash. Dry. And as I said before, we'll give this over 1 minute. So it'll be 0.5 milliliters per 15 seconds. Alright, it's been a minute. So I've given the medication over a minute. I'm getting rid of my syringe here. And I'm gonna do another alcohol swab for 30 seconds. I'm gonna have another flush here, and this time we will be using the flush, and this time when we use the flush, we'll be doing the same rate as the medication because there is still medication in this IV line, so we don't want to push it too fast. So 15 seconds per half a milliliter for 5 milliliters. And we'll do this over the span of 1 minute. So I'm going to verbalize that it has been 1 minute. And we are done here. And I throw that away. And I swab again for 30 seconds with a clean swab. Now I'm going to put an orange, usually orange cap, this one is blue, but orange cap over my port. Alright, now I am uncrimping. And I'm going to hit start back on my IV pump here, and I'm going to take off my gloves and wash my hands. And this pump is still going 100 milliliters per hour for this medication, so we are good to go there. And I'm going to document my medication administration and the education that I gave to my patient while I was in the room. And Mr. Brown, if you have any questions, please let me know. Do you need to use the restroom? Are you in any pain? Here's your call bell. And I'll be back in about 30 minutes to check on you, to make sure that you're feeling okay, and make sure your medications are working, and make sure everything is all right. All right? Okay, thank you.